Renal function test. What are the tests we are going to do when patient complains from the heart, from kidney? Not only the kidney. For renal function test, you will do all serious patients, سواء كان مريض في القلب أو في الكبد or any other disease. Whenever you are in the ER, طوارئ, patient came to you, first you have to evaluate his kidney. Okay? Right. Kidney problems are very common in clinical medicine. Essentially, all serious sick patients, سواء كان cardiac patient or liver patient, sick patient will need their kidney to be evaluated.
Diabetes also?
Diabetes also. All sick patients, you have to evaluate their kidney during the course of their illness. After history and the physical examination, the initial step you are going to check for the patient is to evaluate his kidney. What are the tests you are going to do? The tests you are going to do will be abbreviated in U and E.
U and E?
Ayo. U and E. What's U and E? Urea and electrolyte. Urea and electrolyte. Okay. Electrolyte.
Creatinine.
Electrolytes. These electrolytes are sodium, potassium, chloride. Some hospitals, they will also use bicarbonate, HCO3. But these three are the electrolytes which are very important. And then urea. Urea and creatinine.
Creatinine, clearance.
Creatinine and urea, they are also evaluated. Right? So electrolytes are sodium, potassium, and chloride. Sodium, potassium, and chloride. Right? Sodium is intracellular or extracellular? Extracellular. So the value of sodium will be high in the extracellular fluid. So it is between 130 to 145. Normal rate.
PCF.
Right. Well, potassium, intracellular or extracellular? Intracellular. So the value of potassium will be low. That means come 3.5 to 5. Okay. Right. Chloride. Intra or extra?
Both.
Extracellular. So it will be the same value with
Sodium.
Okay. Right. Sometime what will happen? All anticoagulants. What's an anticoagulant? Anticoagulant. Anticoagulants are chemical compounds which inhibit
The
blood to clot. Okay? So tubes which contain the anticoagulant, sometimes they contain potassium.
fluoride.
Potassium EDTA, potassium citrate. So
Sodium
whenever in a mistake, nurse collect the sample and they put into the tube which contains potassium, the value will be high. So whenever you get high potassium, patient who get potassium above 80, that means she's not alive. Dead patient. Potassium high will cause a patient death. How? What will do the potassium? Cardiac arrhythmia or arrest? Cardiac arrest. Okay. So patient who have high potassium, that means he's not living. Sometimes result comes to you to the laboratory. Written patient who have potassium of 30, 32. That means the sample is contaminated with the potassium. So can with the anticoagulant or with the injections they will give you. So such a sample, when you get, you have to reject. It's impossible. Okay? potassium أكثر من 5 will be problem. Right? So these are the electrolytes, sodium, potassium, and chloride. Then we will see the urea. What's the urea?
Waste product.
Waste product of
Protein.
protein. Protein catabolism will give you ammonia. Ammonia will be converted into water soluble from the
Urea cycle.
It's eliminated. Right. What about creatinine?
Waste product of muscle.
Waste product of creatine phosphate.
Phosphate,
Okay.
yeah.
So the creatinine is eliminated in the kidneys. Okay. Creatinine is eliminated in the kidney. So these are the wastes which are eliminated in the kidney. Their value is here between 30 to 45 milligram per deciliter. Creatinine 1 to 2 milligram per deciliter. Like, these are the waste compounds. If they decrease, what will happen? Urea 3. And it does not make you any sense. But whenever urea is high, أكثر من 45, that means the kidney is problem. It's not eliminating the waste. Creatinine, the same thing. Okay. In the creatinine, we will also see what we call CC, creatinine clearance. What's the creatinine clearance? It is the rate of glomerular filtration. The rate of glomerular filtration, in which we will see normal person how many milliliter per minute. In each minute
125.
is eliminated in this kidney. Okay? How many milliliter of urine per minute eliminated this patient? So normally it is
125.
75 to 120 ml per minute. Okay? So in these 2 weeks, this is what we are going to see. Electrolytes, we will not do it. This week we will do urea, and next week we will do the creatinine. How we do this sample? After a history of physical examination are complete, the initial step in which to check your patient is to do what you need. Whenever you go to the Tawari, ER, in any hospital, they will ask you to do this test. You are needed, okay? So checking the patient's kidney are performing the following tests. First, urine analysis. Okay? Urine analysis, serum creatinine, urea creatinine, or BUN. Next, you may check the ability of the kidney to concentrate. Okay? Both creatinine and BUN. BUN means blood urea nitrogen, are included in the common chemical profile. You can check the ability of kidney to concentrate by using what the urine analysis in a hygrometer. Right? The method, chemical test of urea. Urea we can do 2 ways. First, in a chemical reaction test. That means urea will be reacted with a chemical compound, diacetyl monoamine, which can be colored, yellow color, and then we will estimate. So nowadays, all these chemical reactions, they will no more use in the hospital. Why they don't use SL filter? Why they don't use?
Use what?
Any chemical test.
Not accurate.
ليش not accurate؟
ما يدمج.
زي البلاد جلوكوز، ايش قلنا؟ البلاد جلوكوز the chemical tests which are Benedict and so on, they will no more use. Why? Because there are other compounds which can also react, so they can give you false positive. Right? Instead, they will use an accurate test, which are في الجلوكوز ايش قلنا؟ لا في الجلوكوز what are the tests which we have used it? لا الرياكشن which we will
Benedict's reagent.
determine glucose. It was an enzymatic method. Enzymatic method.
You mean the method?
Reaction of glucose with enzyme. Okay? Reaction of glucose with enzyme.
لا ما
طيب
كم باقي دكتور؟
ايوه
كم باقي له؟
ليه؟
دوبل بالي.
تدوبكم باقي؟
ليش؟
احنا متى حنجيك طيب؟
فين؟ انت اللي بحثك فين الباقي؟
الباقيين موجودين.
فين؟
ها؟
فين؟
ليش فين؟
انت مع المجموعة هذه ولا؟
انا مع المجموعة الثانية.
طيب فين؟
يعني كلنا مع بعض قصدنا
احنا اللي
لا لا
بدنا
فين؟ انت اللي وحيد جاي. فين المجموعة؟
احنا نبغى نخلص دحين عندنا فسيول نروح نادي.
طيب انا اقصد انتم كم فريقكم؟
خلاص دحين جيبهم عشان
ايوه
طيب انا هجيبهم دحين.
خلاص نمشي.
خلاص خليك انت. ها؟ طيب so the same thing in the urea estimation we will use an enzymatic method. طيب urea plus water with the enzyme urease we will have carbon dioxide and ammonia. Okay. كيف الشكل اليوريا؟
بالهكساجون
يوريا
هكساجين.
These are the urea. Okay.
The form.
طيب when we add water with the enzyme urease that means it breaks down the urea we will have ammonia plus carbon dioxide. Okay. Plus carbon dioxide. Right? This ammonia, we will add a compound called sodium salicylate plus sodium hypochlorite plus sodium nitrobroside to get an endophenol, a pink color. And then we will estimate it pink color. We will get it to 540 wavelength and we will put the reagent so that we will see and then we will see how much the absorption. Okay. طيب. Procedure. الخطوات اللي حنشتغل حيكون ايش؟ Sample. We are going to get 0.01 ml. How many microliter 0.01 ml? ايوه يا دكتور. How many microliter?
100.
ايوه. 100. ليش 100؟ ايوه 0.01 ml how many microliter 1 ml how many microliter يا دكتور 1000 طيب 0.01 ضرب 1000 كم يجي
0.01 يجي
10 microliter 10 microliter okay we will get 10 microliter of the sample and then we will add reagent to 1 ml ايوه يا شباب خليكم معايا الخطوات اللي حتشتغل is very important. Okay. Procedure. Procedure. Sample. You will get 10 microliter of a sample. Step number 1. Okay. And then you will add reagent 1 reagent 1 ml. ايوه التجربه اللي حتشتغلوا اليوم مش الاسبوع. اوكي طيب خلاص يا شباب. Reagent 1 which contains the enzyme urease 1 ml. Okay, you will mix and incubate, wait 5 minutes. Okay, then you will add reagent 2. Okay, طيب. You will mix step number 3. You will mix. You wait 5 minutes. Okay, you will wait 5 minutes. And then you will add reagent 2, 1 ml. Reagent 2, 1 ml. Okay, you will mix and incubate for 10 minutes. Incubate 10 minutes until the color is produced. Then you will get the absorption. Incubate 10 minutes and get absorption at 540 nanometer. Right? Calculation. How you calculate absorption of the sample? Absorption of sample divided by absorption of standard times concentration of standard. This will give you urea milligram per deciliter. Okay? Milligram per deciliter. Normal range of urea is 15 to 45 milligram per deciliter. 15 urea count. 30, okay. Lower up to 15. Lower value is not problem. من 30 ل 45 ملغ per deciliter is the urea. أكثر من 45 that will be the problem. That will be the problem. Okay, fine. Interpretation. How do we interpret? Increased amount of bilirubin, urea, sorry. Increased amount of bilirubin is by definition we call azotemia. Azotemia. It is either due to increased protein catabolism or impaired kidney function problem in the kidney. Increased protein catabolism can be a really heavy protein meal. Patient who have meal rich of protein can have urea high, but not as much as when there is problem in the kidney. Severe stress, whenever myocardial infarction, high fever, patient can have a protein catabolism. Upper gastrointestinal bleeding. Gastrointestinal bleeding can give you urea high. Impaired kidney function can be parenchymal azotemia. This is result of underperfusion of the kidney, dehydration, hemorrhage, shock, congestive heart failure. All this can give you high urine. Renal azotemia has severe familiar causes. Acute tubular necrosis, glomerular nephrosis, chronic interstitial nephritis, glomerular nephritis. All will give you high urea. Okay? Post-renal azotemia can be obstruction of urinary tract flow when there is a retention of urine. In acute renal failure, blood increases abnormally up to 20 milligram per deciliter each day, estimating range of أكثر من 45. Okay, طيب. These are what we are going to do. Renal function test can be urea and creatinine. Okay, these are the procedure of urea. Next week we will do both creatinine and urea. If you don't have enough time, then have to come at 10. You have to come on your punctual time. If you have a time, next week you have to come at 10, and then we will finish by 12 with the two tests.
اوكي
Creatinine and urea. Okay? طيب.
ليه بكره الاسبوع الجاي ما في خلاص؟
خلاص.